Hey guys, this is Marcel Irnie. It is March 10th, 2022, 4:25 p.m. Bonnie Henry, or as my friend Bev says, Bonnie Hitler, just did a press conference, live press conference, and updates on the mandates, the vax passport, the breathing barriers, and or whatever she calls them, face coverings. The ones that the police hide behind, right? Like Conrad Herbs. And so let's watch it. And if it's just pure propaganda, I might fast forward a little bit. So let's check her out and see if we can survive and find up the update today, March 10th. So let's head it up. I'll just have one here for sure. Let's go.
Good afternoon, everyone. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Thursday, March the 10th, 2022. Dr. Henry and I are honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Dr. Henry will be referring to a PowerPoint, which will be available on social media and on government websites, including the BC CDC and gov.bc.ca shortly. And with that, it's my honor to introduce Dr. Bonnie Henry.
Your honor? Some honor.
Thank you very much and good afternoon. Today, we're going to walk through where we are in the pandemic and talk about where we're going next. To start with, where we are today, we are progressing well and we're going in the right direction. And it really is thanks to people in British Columbia stepping up and doing what we needed to do. We now have over 55% of children 5 to 11 who have been vaccinated. Over 90% of British Columbians 12 and over have received their first dose of vaccine, 2 doses of vaccine, and about 56% of people have received that important booster dose. Our hospitalizations continue to decrease, which is also really good news.
Bullshit.
If we look at it in terms of our epidemic curve, we see that our cases of lab-confirmed cases have come down dramatically in the last few weeks, but really importantly, our hospitalizations have also decreased, and the number of people in critical care has decreased.
Because it's a common cold?
This is encouraging, because as transmission goes down, so the risks to all of us go down in the community. Our approach has always been to only have the minimal necessary restrictions to keep people safe and to prevent the transmission, particularly to those who are more susceptible to severe illness with COVID-19. It is finding that balance. I am incredibly grateful to the millions of people throughout our province for your willingness and support in adopting our COVID-19 safety measures. Your efforts, combined with these high vaccination rates, have saved countless lives. Together, we've done what is right at the right time. And now we are in a place where we can once again adjust our approach. If we look at our hospitalization rates, another important measure, of course, is by age. And we know that it continues to be our elders and seniors across our communities who are more at risk of severe illness and hospitalization, and thankfully that continues to come down as well. We have a number of different surveillance measures that we have been following closely. One of them, of course, is our wastewater surveillance, and we see a consistent decrease in low levels of virus now being detected in wastewater. And so that is also another important measure that helps us understand where we are in terms of risk in our communities. If we compare where we are compared to other jurisdictions across the country, we see that we have had a lower peak and a slower peak than many other places, and our hospital admissions specifically have decreased by about 34% in the last month to less than 100 new admissions each day. We also know that with the Omicron variant that has come into play in the last few months here in British Columbia, that admissions to hospital with COVID have decreased more than people who have been detected with COVID. And if we can, the same comparisons with other jurisdictions around the world, we see that the actions that we have taken here in British Columbia and that people have stepped up and been vaccinated has meant that we have fared well compared to many other jurisdictions in the country. If we look at our hospitalizations compared to the modeling that we've been following over the last few months in particular, we see that we've tracked along where we've expected to be with the rate of vaccination and immunity that we have in our community, and with people taking those measures that we put in place to prevent transmission. And we expect that to continue as we are in a good place today. We are one of the most vaccinated jurisdictions in the world. And that layer, that protection that we get through vaccination and that immunity that we have across our communities has meant that we have been resilient in getting through the Omicron wave. It has protected. And yes, the risk of infection with Omicron and the protection that we get from 2 doses of vaccine is less than with some of the other variants, but we have seen very strong protection against severe illness, and we do know that people with 2 doses of vaccine are less likely to get infected themselves, less likely to transmit to others, and that increases the protection that we see with 3 doses with that booster dose, bumps it up to over 60% protection against any infection, and that again protects against transmission to others. We also on this slide have put in some of the additional immunity that we have in our community from people who have been infected, particularly recently with Omicron, to give you a sense of the small proportion that is also an increase of protection that we have of immunity across our communities. We know that people who have 2 doses of vaccine on board who got infected with Omicron, most of whom thankfully had a relatively mild illness, have a good, strong booster effect from that infection as well. This means that the level of immunity that we have across BC right now means that we can take some of the tools that we have been using consistently and repeatedly and relax some of these measures. The most, just to follow up on our whole genome sequencing that we've been doing, we can see the red is when Omicron came on board. We are starting to see some geographic changes in variants. They're all considered Omicron, but as we see, as it replicates, it can change slightly. And we've seen the BA1, which is the lighter red, and BA1.1, which has increased in the recent weeks, and a little bit of an increase in the BA2. That is one that we've been watching carefully around the world because it does seem to have even increased infectiousness, but so far we're not seeing a rapid growth in that. And as numbers of cases have come down, while the percentage is going up, the absolute number of people with BA2 is actually going down as well. And it tells us again that as rates of transmission go down, we're all protected a little better. So what does that mean for us now? With the science and our data top of mind, it clearly shows that our risks now are much lower. They're not zero, and we're not fully out of this yet, but I feel confident that we can safely make some further changes. For many months now, we've had a number of tools in our toolkit that have helped us to get to this point.
I like how they call it
We've had to use all of them, all of the time.
Toolkit.
And we are now transitioning to using some of our available tools, some of the time, because we are in a lower risk place. As of 12:01 tomorrow, so not 11:59, 12:01, March 11th, the following changes to the Provincial Health Officer Orders and Guidelines will come into effect. Firstly, will be repealing the face covering order. The order restricting overnight child and youth camps will be lifted, and that's one that will be of particular interest to some parents in particular, and camp operators. This was the order that required that a specific COVID safety plan be in place and be approved by MHOs. So we can now start to plan for having summer camps for children and youth. We are going to restore the visitation policies that we had in long-term care prior to the additional measures that we put in place for Omicron. So that means that starting a week from tomorrow, on March 18th, We'll be restoring a long-term care visitation, and the goal will be to increase visitation and opportunities for connection between residents and families while continuing to protect those we know are most vulnerable to serious illness. We know that there are some challenges across the board, but including in long-term care with things like staff shortages, and operators may need to manage visitation based on the situation with each individual care home. So what I'm asking for is patience. Over the coming week, all of the care home operators will communicate with families around their plans for resuming broader social visitation. And in some cases, depending on the individual situation, this may mean planning visits in advance or spacing them out because of need. The requirements for being fully vaccinated will continue to be in place, as will testing with rapid tests on entry to long-term care.
Oh, so you got to be vaccinated.
So just to talk a little bit more about repealing the face coverings order. This means is that masks will no longer be mandatory in those broad ranges of indoor environments that this order sets out. However, some settings will still require that you wear a mask. For example, for healthcare settings, physicians' offices, patient contact. But in most low-risk locations, it will now be an option and no longer a necessity. Critical to success, though, as we move through this transition phase, is for everybody to move at your own pace. We have learned and we know now a lot more about masks than we did a few years ago. They are both a layer of protection for ourselves and, importantly, a layer of protection for those around us. So while masks are no longer required or mandated under an order as of tomorrow, some people in some locations will and continue to use masks personally or in their business, and that's okay. We need to support that. We need to recognize that we all have our own risks and our own vulnerabilities, and particularly if you are older, if you're immune compromised, you may still wear a mask in some locations, especially if you're inside or around a large number of people that you don't know. If you've not yet had your booster or your children are not yet vaccinated, then masks continue to be a very important protective layer that you may want to continue to use, especially in larger crowds and
what's
indoors.
The absolute efficiency of the mask there, Bonnie Henry?
If we, in part of the mask order was that COVID safety plans needed to include masking in common areas of workplaces. That is no longer an order, but in many workplaces, masks will still be required. They just will no longer be mandated in those areas. Masks continue to be encouraged in some of those settings where we have to get close to other people and we can't necessarily avoid it in things like public transit and on BC ferries. But they're no longer, as I said, mandated under an order. The other important sectors that this affects, of course, are childcare and early childhood education and our K-12 sector. So childcare guidelines we're going to be revising them. We're in the process of revising them with our childcare and early childhood educator stakeholders, and they will be updated to reflect the different risk levels and the use of masks. And the K-12 school guidelines as well. And this means that masks will no longer be required in all settings in schools once children and staff return from spring break. So we recognize that spring break is slightly different in the 60 school districts across the province. Some, a good portion start tomorrow, and a number start the end of next week. And so what we have done is made sure that all of the revisions in the guidance will come into play when you return from spring break at whenever that is for each school district. And if you're not sure which school district it is, there'll be a link to that on the website with the order. Additionally, those workplaces that are federally regulated will need to continue to follow federal health orders and guidelines around workplaces. So what's ahead? In addition to the changes in orders and guidance for today that start soon, we intend to remove additional orders in another 4 weeks, effective Friday, April 8th. And that is, of course, assuming that our conditions continue to improve. These will include the BC vaccine card will no longer be required in those indoor settings and higher risk settings and events. Businesses will transition from the workplace safety order, which requires COVID-19 specific safety plans, to the previous plans that we had in place last summer, the communicable disease plans. So those will be specific to each industry or business. In addition, we're going to be repealing an order that requires post-secondary students who live in residence to be vaccinated. And workplaces will transition back to this requirement rather than having the broader communicable disease plans in place. Sorry. So those are going to be effective on April 8th. As we said, we're going to take a balanced and transition approach over the next few weeks. I do also want to talk about the Regulated Health Professionals Order. As you know, earlier this week we published the current part of the order that requires regulated health professionals to report to their college their vaccination status by the end of March. And this has been a change in how we're approaching this order, given the situation that we're in right now, but also given our ongoing consultation with the various colleges that are affected. So we want to ensure that colleges had the ability to collect that information from registrants and to do it in a confidential, as well as making sure that we had the ability to provide options to people in the regulated health professions, including the new protein subunit vaccines like Novavax. And there has been a delay in our receipt of Novavax. We had expected it to be in the province by last week, and it looks like now we may not receive it until either the third or last week of March. So I think that's a very important consideration, both for those people who already have been affected by orders in their workplaces, but also for the regulated health professions. We are taking then a measured approach based on the risk and impact with each individual college as we go forward. So that means we will have in place a measure for informed consent so that people can understand that there'll be disclosure to clients or patients of vaccination status for some of the regulated health professions. And for others, there may be additional measures that we need in place. So yes, this is different from our original vision, which would be people not being able to practice.
All the colleges,
if they,
the chiropractors,
if they were not
they put a lot of
vaccinated
pressure
by March
on this,
24th.
and now she's backtracking a bit, it looks like.
We've been working through the specifics with each individual college, and based on the risks within each profession, there will be a component of public reporting, as I said, and then we will continue to take additional measures as needed, considering the important impact on from each individual provider. I do want to say as well that our aim is to be consistent with the healthcare worker order that we already have in place that has been so important in supporting us, particularly through the Delta and Omicron waves in our healthcare sector, in health authorities and hospitals in the community. It is an important measure that ensures we have continued high level of immunity in our healthcare sector as we go through this transition phase and prepare for what comes next in terms of SARS-CoV-2, because this virus is still with us. We are not yet at the place where we enough and we know the patterns and the changes that this virus will undergo and to be able to call it endemic. But we are learning to live with it in a more sustainable way at the same time as supporting people to recover from the measures that we've been through for the last 2 years. So really, while we are able to announce these changes today, it's very important that we continue to follow our safety basics as much as possible to keep COVID-19 low and slow, In particular,
Low and
I continue
slow.
to strongly urge you to ensure everyone in your family is vaccinated and have your booster if you have not already done so. These
I
are
urge you to
layers that
take
are
a vaccine
important for
that's
us
not
to be
approved,
using all
that
the
is
time.
dangerous.
But we are in a transition phase. We need to be ready and prepared
putting you in
for
the
what
hospital.
the virus may bring next. And there are many different scenarios that we are working through to make sure we understand the potential,
That doesn't do
particularly
anything.
as we go into the fall. But right now, the important things
Is it
all of us
effective?
need to do are monitor ourselves for symptoms,
Is it safe?
making sure we stay home if we're feeling unwell, get tested, and we now have increasing
Where do
access
you
to
draw the
rapid
line?
antigen tests to help support you in making those decisions. Washing our hands regularly, staying home if we're not well,
Sixth.
getting boosted, and ensuring we get vaccinated. And importantly, as we have done through this whole pandemic, we need to respect people's comfort levels and their own risk levels. And we've talked about this in
Respect
a
our
number of
comfort
different
levels?
ways. We all
When
have
have you
our
ever
own risk,
respected our
and
comfort?
we may not be aware of the risks of those around us.
Do you
We
think
need to be
segregation and
respectful
stress and
about
anxiety is
mask-wearing.
comfortable?
We need to be respectful about people's choices to keep their
You think-
gatherings
have you been
small or
respectful
to
about
stay
our choices
outside
of medical
rather than
autonomy?
inside.
Henry
And
Hitler?
while today is another really positive step forward, we have to be ready to bring some tools back, if necessary, depending on the situation as it changes.
She's telling us that she's going to bring him back. Be
We are
prepared.
also paying a lot of attention about what's going to happen next. It's become clear to us that COVID is going to be with us, that SARS-CoV-2, this virus, will be
Never going away.
circulating in communities
We're
for
always
time
gonna
to
use
come.
this emergency
And it
on you.
means that we have to add it as another virus that we need to pay attention to and manage in an ongoing basis, along with the other serious respiratory illnesses like influenza.
Influenza?
And RSV.
I thought
And
influenza
so that
was
is the-
extinct.
the,
It only had, what,
position
60
that
or
we're
70
taking, that
cases
we're
last
looking
year,
at through
as
what
opposed
are
to
the surveillance
68,000.
mechanisms. What
What
do
are you
we need to
talking about,
monitor
Bonnie
over
Henry?
time to help us
Influenza on the
understand
Canadian
the
website
impact on our
disappeared.
communities?
COVID
When we're
replaced it,
starting to
remember?
see surges, if the virus is changing, what's the impact on hospitals
Man,
and,
does she ever shut up.
and our healthcare system?
full of
So we are
shit.
continuing to do population level sentinel surveillance, and we'll be integrating it with our influenza and RSV surveillance over the coming
Influenza surveillance.
months.
Yeah,
we'll
what about the
continue to
surveillance
do
of 2020,
facility-based
2021, huh?
monitoring in acute care and long-term care. We have systematic early warning
All right, I've had enough of
signals
this
through
crazy
things
woman.
like our waste.
All right. Enough propaganda from Bonnie Hitler. Anyways, today is March 10th. So they're lifting the breathing barrier mandate in BC for now. You still have to have a passport to go visit your loved ones in a nursing home. And supposedly they're going to remove the mandate of the vaccine passport in, what did she say, in a month, in April, like 11th. But word is that the federal mandate, the digital ID and federal mandate, is going to be coming down the road in May. So don't get your hopes up that anything is getting better. We must keep holding the line, pushing forward, keep walking, marching across Canada. If whatever you're doing is raising awareness, keep talking, telling your friends. It's like, is it safe? Has it stopped the transmission? Ask your friends, has it stopped the transmission? Where do you draw the line when you decide that you're not going to be pro for allowing Hitler Henry here to keep saying this shit? Okay, on to the next news story. Oh yeah, and if you don't know, I'm back in where my rental is. That's why I'm just hanging out in back at where I live, and I hope to join back up. I'm thinking next week I'm going to drive out and catch up to James Top and the whole team, and film them maybe like Wednesday next week. I'll film the next time, and Tuesday will be my drive day to catch up to them, and they'll still be in BC for a little while, so there's still time. So keep you updated. Cheers, guys. Oh, here comes the race cars. They're coming up around the corner.
Here they come. Let's give them a cheer. Woo!
It's so funny. It's like we're at a racetrack cheering on the racers. The race across Canada.
Here they come, you guys. Hello!
Look, you guys got some fans.
Hello, hello, hello. Hey.
Hello, hello.
Hi.
How are you? Can we hug you?
Oh, hey. Hey guys, not much till we get to some. Wow, thank you.
What do you got? Some treats there, huh?
Yes, of course.
Oh, nice.
Can I have one now? What's your name? We only have one. Oh, hi. Nice to meet you. I'm James.
No, they're coming with us. They'll be up the road in a bit. This is more than
We want to be super sure there's no business in that.
nice bags you got there. Nice. I got one somewhere, right?
I got that car. Would I be able to get a picture? Would somebody be able to snap me?
Yeah, and I can take one with my phone too and email it to you.
Oh, sure.
I'll give you a card. Since we're in the same town, right?
Yeah.
All right.
Cheese. Thank you, Canada.
Awesome.
There's